Hi guys, so today we are going to be talking about the sacrum vertebrae or the sacrum bone. Yes, like I said before in the previous video of the lumbar vertebrae, I said the lumbar vertebrae is one of the bones of the abdominal region, and others being the lower ribs, the lumbar vertebrae itself, the hip bone, which is the pelvic bone, and the sacrum or the sacral bone, which is attached to the coccyx. General features of the sacral bone. The sacral bone is made up of 5 fused sacrum bone. So let's count the 5 bones. We have 1, 2, 3, 4, and 5. It has some several features that are similar to those of the other vertebrae, but just a few of them. So now let's go to the things we can see on our sacrum bone. We have 2 surfaces, anterior surface, which is also called the pelvic surface, and the dorsal surface, which is also called the posterior surface. So the pelvic surface or the anterior surface is smooth, and the posterior surface or the dorsal surface is rough and presents some elevation and depression. Now to the pelvic surface, the things we see our transverse ridges, and our transverse ridges is formed by the fusion of the sacral bones. Also on the anterior surface, we have the anterior sacral foramina on both sides of the body of each sacral bone. Now on the posterior surface, on the other hand, like I said before, it is rough and it presents some elevation and depression. So on the posterior surface on the sacral bone, we have 5 crests. This is the sagittal section of the sacrum, and this is the posterior surface of the sacrum. So there are 5 crests: the median sacral crest, intermediate sacral crest, and the lateral sacral crest. Again, median sacral crest, intermediate sacral crest, and the lateral sacral crest. 5 crests. The median sacral crest is formed by the fusion of all the spinous process of the sacrum bone. Now we know from our lumbar vertebrae that the typical features you can find include the body, the pedicle, the lamina, the spinous process, the transverse process, superior articular process, and the inferior. Now on the sacral bone, on the other hand, the spinous process of all the 5 sacral vertebrae, they fuse to form the median sacral crest, as you can see. So this is our median sacral crest. Then this is our superior articular process. The sacrum has only one superior articular process, while the others are fused. So the intermediate sacral crest is formed by the fusion of articular processes, the sacral articular processes, while the lateral, on the other hand, is formed by the fusion of the transverse process of all the sacral bone. So this our transverse process. So the fusion of all the transverse process of all the sacral bone forms the lateral sacral crest. Again, median sacral crest, fusion of spinous process, intermediate sacral crest, fusion of articular process, and lateral sacral crest, fusion of transverse process. Other features we can see on the dorsal surface is our dorsal sacral foramina or posterior sacral foramina. We also have an inverted U opening at the lower part of the median sacral crest. This inverted U opening is called our sacral hiatus. On both sides of the sacral hiatus is our sacrum conum, and that is formed by the free articular process of the last sacrum bone. The last sacrum bone, the articular process does not fuse together with the intermediate sacral crest, so it gives rise to the sacral conum. Again, median sacral crest, intermediate sacral crest, and lateral sacral crest, right? Then sacral hiatus, sacral conum. Then we also have our sacral canal, which is located posterior to the body. So this is our sacral canal, this opening in the upper parts towards the base of the sacrum. This is our sacral canal. Other features we can see on the sacrum are the ala of sacrum, and the ala of sacrum is a wing-like projection on both sides of the base of the sacrum. Anteriorly, on the first sacral vertebrae, we have our sacral promontory, and this is just an elevation or a protrusion of the superior border of the first sacral vertebrae. Let's go over all the features of the sacral vertebrae. 5 sacral bones fused together. The fusion, they meet at the sacral ridges or the transverse ridge. Anteriorly, we have pelvic sacral foraminal. We have our transverse or sacral ridges. We have our base, which is upwards. We have our apex, which is directed downwards. Then posteriorly, it is rough. We have 5 sacral crests: the median sacral crest, the intermediate sacral crest, and the lateral sacral crest. The median sacral crest is formed by fusion of the spinous process. The intermediate is formed by the fusion of the articular processes, while the lateral is formed by the fusion of the transverse processes. Then below the median sacral crest, you have an inverted U opening, which is referred to as the sacral hiatus. On both sides of the sacral hiatus is our sacral conus. So this structure here, as you can see, in the sagittal section, this elevation, this lower part, is the sacral conus. This is the ala of the sacrum. This is the superior articular process with the superior articular facet. Again, ala of sacrum, superior articular process with the superior articular facets. And oftentimes, the superior articular facet can be painted and they can ask what it articulates with, right? So it articulates with the inferior articular facet of the fifth lumbar vertebrae. Yes, so to the relation of the sacrum, we have structures that are related to the anterior surface of the sacrum, which is the pelvic surface. So I'll be listing the relation, of which they can be painted in steeplechase questions to be asked what is related to their area. Some paintings are already there. However, the ones that are not there, I'll just be stating it, right? And be aware that I'll be asking us a few questions at the end of the section. Yes, so let's get to it. Now, the first relation is the median sacral artery. So the median sacral artery is directly related to the midline of the body of the sacrum around this area. And the median sacral artery is a direct branch of the abdominal aorta, just about its termination at the level of L4 lumbar vertebrae. So just medial to the median sacral artery, we have our superior rectal artery. So the superior rectal artery is a branch of the inferior mesenteric artery located in the upper part of the sacrum bone. Is our superior rectal artery, a direct branch of inferior mesenteric artery. We have our lateral sacral vessels emerging from the pelvic sacral foraminal. Also, from this pelvic sacral foraminal, we have our anterior rami of the sacral nerves emerging from it. Two things come out from the pelvic sacral foraminal. They are the lateral sacral vessels and the anterior rami of sacral nerves. So to the ala of sacrum, we have structures related to the ala of the sacrum structures, and this part is often painted in steeplechase questions. This part is often painted. As you can see, there is already painting on this region. 4 things or 4 lines are drawn. 4 lines are drawn. 1, 2, 3, 4, right? And these 4 lines represent 4 structures. The 4 lines represent 4 structures. Now, these 4 structures, there is a mnemonic for it. From lateral to medial, it is oils, OILS. So let's name it. We have obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic chain. Again, obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic chain. This sympathetic chain descends on both sides of the median sacral artery to come and terminate as the ganglion impar. Then for the sacral canal, we have structures entering into the sacral canal, which is otherwise referred to as the content of the sacral canal. And we also have structures coming out of the sacral hiatus. So content of sacral canal, and structures coming out of sacral hiatus. Now to the content of sacral canal. Number 1, we have the filium terminale. Number 2, we have the spinal meninges. Number 3, we have the lower part of cauda equina. And number 4, we have the lateral sacral vessels. Again, filium terminale, spinal meninges, lower part of cauda equina, and lateral sacral vessels. So those are the contents of the sacral canal. This part is often painted and asked in steeplechase that what is the content of sacral canal. So we have the filium terminale, the spinal meninges, the lower part of cauda equina, and the lateral sacral vessels. Now to the structures coming out of the sacral hiatus. There are 3 in number: the filium terminale, coccygeal nerve, and the fifth sacral nerve. Three structures: filium terminale, coccygeal nerve, and fifth sacral nerve. To the muscular attachment on the sacrum. So we have muscles on the pelvic surface and we have muscles on the dorsal surface. So I'll just mention the muscles and I'll show us where they are attached. So on the pelvic surface, we have iliacus, we have piriformis, we have coccygeus. Then on the dorsal surface, we have erector spinae, we have multifidus, and we have gluteus maximus. Iliacus is attached on the ala of sacrum. So if this area is painted and it is not 4 lines like it is here, right? If it's just a big painting and you are asked that what structure is attached to this area, it is iliacus. Piriformis is the next muscle. As you can see, there is already a painted area here, and this painted area is like a E. So the piriformis is attached to the transverse process of the middle 3 sacral pieces. Then the last one is coccygeus, and coccygeus is attached to this area, to the lower area of the sacrum, this area. Then on the dorsal surface, I said we have 3 muscles: erector spinae, multifundus, and gluteus maximus. Now follow my hand. So from the median sacral crest to in front of the lateral sacral crest, it gives origin for erector spinae, or it gives attachment for erector spinae muscle. So from the median sacral crest, a U shape, to in front of the lateral sacral crest, we have erector spinae. Then inside that U, if a U is painted that way and you're asked to identify what structure is attached there, that is our erector spinae. However, if it is inside the U that is painted, or if the U is painted blue and inside the U is painted red, and you are asked to identify what structure is painted red or what structure is attached to the area painted red, that is our multifidus. However, the U painting gives attachment to erector spinae. The painting inside the U gives attachment to multifidus. Then below, just posterior to the attachment of the coccygeus anteriorly, posterior to that area, we have our attachment for gluteus maximus about this area. So the areas that are often painted is this U shape, inside the U shape, the ala of sacrum, right? The attachment of piriformis, which is the transverse process of the 3 middle sacral pieces, our iliacus, our coccygeus. The median part of the sacrum is painted, and you can be asked what artery or what structure is related to that area. That's our median sacral artery. We can be asked to list the structures coming out from the pelvic sacral foramina, and there are 2. We have the lateral sacral vessels, and we have the anterior rami of the sacral nerve. We can also be asked to list the structure or the content of the sacral canal, and there are 4. Let's list them: filium terminale, spinal meninges, lower part of cauda equina, and lateral sacral vessels. Then also we can be asked to list the structures coming out of the sacral hiatus, and there are 3: filium terminale, coccygeal nerve, and the fifth sacral nerve. Now to other notable things on the sacrum, we have our auricular surface. The auricular surface articulates with the auricular surface of the ilium, forming a plain type synovial joint because it does not permit any movement. So you can this area can be painted. You can be asked two questions or more than two, but the two I can say are to list or to mention the joint, the type of joint it forms, and what it articulates with. So the auricular surface of the sacrum articulates with the auricular surface of the iliacus. Come on, sir. Then to the remaining structures on the sacrum that I haven't mentioned before, we have our auricular surface, right? Auricular surface, and the auricular surface articulates with the auricular surface of the ilium, right? Auricular surface of the sacrum articulates with the auricular surface of the ilium to form the sacroiliac joint. This area can be painted and you can be asked to name the structures it articulates with, right? So this area can be painted and you can be asked to name the structure it articulates with. So it's the auricular surface of sacrum articulates with the auricular surface of ilium. Also, another question you can be asked is to name the type of joint it is or it forms. So the type of joint, the sacroiliac joint, and the type of joint it is plain type synovial joint. Plain type synovial joint because it does not permit any movement, right? So we also have a sacral tuberosity. So this area just posterior to the auricular surface is the sacral tuberosity. Auricular surface articulates with auricular surface of ilium at the sacroiliac joint, plain type synovial joint, sacral tuberosity, and the auricular surface is on both sides. Same thing goes to the sacral tuberosity on both sides. So this is our sacral promontory. The base of the sacrum articulates with the fifth lumbar vertebrae. Again, this area can be painted. This area can be painted to be. You can be asked what is related to this area, right? So this area is painted. The structures related to this area. Again, it is our intervertebral disc. If the center is painted, it is the nucleus pulposus. If the periphery is painted, it is the annulus fibrosus. If the center is painted, nucleus pulposus. If the periphery is painted, annulus fibrosus. This area, the whole area can be painted and you can be asked what it articulates with. So this articulates with the fifth lumbar vertebrae at the lumbosacral joint. Again, you can be asked the angle that the lumbar forms with the sacrum, and the angle the lumbar forms with the sacrum, which is our lumbosacral angle, and it is 120 degree. So when the lumbar is placed in this area, that angle, when you draw a vertical line and an horizontal line, you're going to measure 120 degree. So the angle the sacrum, the first sacral vertebrae forms with the lumbar vertebrae, with the fifth lumbar vertebrae, is 120 degree. Oftentimes, you can be asked to mention the angle, like you should give the exact value of the angle. Again, the base of the sacrum articulates with the fifth lumbar vertebrae. The body of the first sacrum articulates with the fifth lumbar vertebrae at the lumbosacral joint, and the angle they form with each other is 120 degree. Again, you can be asked the type of joint it is. So the type of joint between the lumbar vertebrae and the sacrum, which is our lumbosacral joint, is secondary cartilaginous joint. Secondary cartilaginous joint. And I've mentioned two joints: sacroiliac joint, lumbosacral joint, sacroiliac, lumbosacral. So the third structure that articulates with the sacrum, or the third joint of the sacral bone, is our coccyx. The coccyx articulates with the sacrum at the sacrococcygeal joint, and the type of joint they form is a secondary cartilaginous joint. So the sacrococcygeal joint is a secondary cartilaginous joint. The lumbosacral joint is a secondary cartilaginous joint. The sacroiliac joint is a plain type synovial joint. The lumbosacral angle is 120 degree, and that's basically all for the sacrum. So this is our sacrum.